When it comes to healthcare, you want a specialized approach, and Comprehensive Cancer Centers does just that with their Lung Center of Nevada division, focusing on pulmonary diseases. But doesn't stop just there. They also focus on what could be stopping you from getting a good night's rest. Dr. George, too, he is here, a pulmonologist with Comprehensive Cancer Centers. Great to have you, my friend.
Thank you.
Welcome in. So, pulmonary, you would think, okay, this has to do with the chest and all that stuff, but this has to do with sleep as well.
Absolutely.
You have a sleep lab, the Desert Sleep Disorders Center Sleep Lab. Tell us what goes on at the sleep lab.
So at the sleep lab, patients usually come in for either one night or whenever, according to their schedules, so that we evaluate for sleep disorder breathing. So this could be something like sleep apnea or snoring. Family members or bed partners may be complaining that the person is snoring a lot and they're like pushing them over.
Literally, my wife last night shoved me in the face, said, "You're snoring, stop it." Yeah.
And so, and we basically hook them up to lots of wires, and it looks like they're coming out with all these gadgets.
Yeah.
And we just watch them sleep and observe and document objectively. Do they snore? Do they stop breathing? And how many times do they stop breathing? And that's how we make the diagnosis of sleep apnea. And we also look for if they're kicking a lot at night and so forth.
Yeah.
And that's the evaluation.
Try to get an idea, a really focused in idea on what exactly is causing the issue. Are you guys open overnight? Is this how this works?
Yes,
or?
it's
Wow.
usually nighttime. Mostly people sleep at night.
So is this your night right now?
No, this is my day.
Oh, okay.
I don't do the sleep lab.
Okay.
We have sleep techs who specially do that.
That's crazy,
Yeah.
unreal. So this ends up helping somebody because then you can finally give them the key to unlock the answer to what's causing these issues and hopefully get them a better sleep.
Correct. So a patient may come in, they may be tired all the time, they may be falling asleep behind wheels, or they may be complaining that, oh, I'm just not sleeping well at all. And this is one of the way for an objective evaluation.
Some people, they think, it takes me a little time to get to bed. Yeah, I wake up a little groggy, but it's the morning. At what point do we say, you know what, this is becoming an issue, let me call a doctor? What is that tipping point?
So again, family complaints. A lot of time it's just to say, you're just snoring so loud.
It's going to be 90% of it is the spouse.
A lot of time the spouse comes in for the evaluation, just to undergo the first evaluation as well. A lot of times it's how they are affecting and impacting their daytime routines.
Yeah.
They can't get to work in time, or they can't go to school in time, or they're falling asleep behind the wheel at work. So those are the times when the symptoms are really impacting one's lifestyle. That's when the evaluation really kicks in.
No question, and this is a part of Lung Center of Nevada, which Sleep Disorder Center is obviously a part of. What other services does that division end up providing? So
besides sleep, we deal with all lungs-related issues, so that could be asthma, COPD, what we call chronic obstructive pulmonary disease, that's emphysema, chronic bronchitis, patients who have a very special disease such as interstitial lung disease, patient who has spots in their lungs that comes in for evaluation. Those are the patients that we see.
So ultimately, you end up from your primary care physician being sent to you to learn more about perhaps what might be ailing us.
Correct. Yeah, a lot of time patient comes in with chronic cough. Unfortunately, with the season with all the winter season, patients may be experiencing a respiratory tract infection, and they have a lingering cough for 3, 4, 5 months, and they come in for evaluations too.
Gotcha. What treatments are available to people that find out that they are diagnosed with a lung disease? What's available out there?
So it depends on what kind of lung disease we're talking about. There's airway disease, or actually lung disease, and there's blood vessels in the lung disease, and majority we use medications. Inhalers, and you see a lot of patients use puffers and so forth, and there's a variety of them. There are other pills and medications, and ultimately if patients require surgical evaluation, we can refer them to surgery centers. There are also lung transplant as an option, although we don't have that services here in Las Vegas. We can refer them out to tertiary centers close to Southern Nevada area.
Of course, and I know there's different options available for people with sleep apnea as well. Getting back to the sleep for a second, we were just discussing that because if you haven't seen a sleep apnea mask, it is something out of a horror movie, and not a lot of people want to have that. There are different options available for that as well.
Correct. So there are people who can wear a dental device that helps to pull the jaws forward a little bit if they cannot tolerate the mask. That looks like a Darth Vader. There's also people we have implants now that you can put in the back of the throat, and they turn it on at nighttime. That will help to stimulate the back of the throat to keep it open.
Wow.
And that's a very new product.
Very, very interesting. And it's very new. I've read into sleep apnea before, and I've never heard of that before. So really, the technology's coming a long way. This is why you got to come in and check it out. Doctor, it's great having you. Thank you so much.
Thank you.
Hey, listen, rest easier. Get the care you need with Lung Center of Nevada. It's a division of comprehensive cancer centers. They're located next to Southern Hills Hospital in the Southwest, right near my house. I'm sure Marsh has already made me an appointment. Their phone number and website are right there on your screen. Comprehensive Cancer Centers, a proud sponsor of the Morning Blend. They're also on social.